Welcome to Ladies Room Live. I'm your host, Kissa, and we're going to be speaking about all things coronavirus. I know it's so scary, but we have our dear friend, Dr. Tashinea Bernadin, to help us out. Welcome.
Thank you.
So let's just get all the way into it. Mm-hmm. Yeah, we have to turn to each other for this one, right? So tell me a little bit more about the coronavirus that a lot of people probably don't know, or just like inform the public, because it's extremely scary. People are watching the news, and what we know from the news right now, that we can be misinformed in so many new ways. I know that you guys as health professionals, you guys are learning about it every single day, but just from a medical standpoint, what can you tell us?
So coronavirus is actually a family of viruses, and people don't know that it's not just this particular virus is a new type of the coronavirus. That's why when it first came out, they called it the novel coronavirus. Oh. Novel meaning new. But coronavirus is a family of viruses. So they all have a certain molecular structure or a shape. And this particular one is new because there are some things that are different about this one that we don't know about like we do the others. So I think a lot of people hear the coronavirus and they think it's like this new thing and, oh, it came from China. And yes, it did originate in China. The first outbreak occurred at a meat market. So I know you're looking like that. I think they're linking it back to bats, something with bats.
Oh, yeah.
Yeah, but at the market, they were selling livestock. So there were rabbits and a bunch of other things there. So basically, we think that this is a virus that kind of, I guess, mutated or became some type of new coronavirus from animals, and then it transmitted from animals to humans. And as you've already heard, it's been causing a lot of respiratory illness, and predominantly in the older population. Now, yes, it can happen in someone like you or me who's pretty healthy.
Yeah.
But if you're older, obviously your immune system is more compromised. If you have chronic conditions, again, your immune system is more compromised, so you're not able to fight a virus off as well as someone who doesn't have an underlying condition. So I think people get afraid, or just, they just start getting anxious because they think they get coronavirus, they're going to die, but that's not the case. We have way more recoveries than we do deaths. So
I guess it's just how we are, known as human. Mm-hmm. We make, the negative really, really big instead of the positive. Mm-hmm. In this standpoint, the positive is that more people are being treated and not dying from the coronavirus, versus people that are dying from the coronavirus. So that's actually really good to hear. I know sports have been canceled, and they have made like a really big thing about that. I know from one standpoint, so many people are like, what am I going to watch?
I know.
Because they have their like routine of, going to work, doing this, doing that, and then coming home and catching the 8 o'clock game or whatever the case may be. But on the other side of the standpoint, when you're hearing all of these athletes, they're testing positive for the coronavirus, does that mean that they're also like experiencing like true symptoms, like they're sick, or are they just being tested and they just have it in them?
So how a lot of the tests is going on, you guys know about the rapid flu. We can test people for flu in office. Rapid flu is just rapid results right then and there.
Right.
I don't remember the false positive rates on those, but it's a rapid kit, so you can get a false positive, just like you can get a false positive on a rapid corona test. Whenever you're testing positive on the coronavirus, they have to send it off for confirmatory testing. So there are a lot of cases that are presumed as positive. They're presumed, not necessarily confirmed. I don't know about some of the athletes if they have been confirmed, but I do know last I heard it was presumed that they were
just testing positive.
Yeah, they just tested positive.
Right. So because you test positive for it,
it doesn't necessarily mean you will have the disease, because again, you can have false positives. Just like with any rapid kit, if it's flu, you can have some false positives.
Right.
Now, if you were to ask me what is the false positive percentage, I have no clue. I couldn't tell you. But anytime you have a test like that, you have the likelihood of having false positives.
And you would get sick if you test positive for it, basically.
Yeah,
like you would go through like flu-like symptoms.
Yes and no. So I won't say flu-like symptoms because there are some differences between the corona and the flu virus. Coronavirus, a lot of people aren't really getting like the body aches. It's more of respiratory symptoms and fevers and shortness of breath. They're getting more of that. Of course, with flu, you can have shortness of breath, you can have fevers. And flu, sometimes you can also get GI symptoms as well. But with the corona, we're not really seeing that. At least we haven't, heard of any cases where someone's having diarrhea or nausea or anything like that. It just seems to be linked specifically to respiratory illness and fever, shortness of breath, which again goes with the respiratory symptoms.
Okay. So what are the symptoms of coronavirus?
Shortness of breath is definitely one. A fever, and we define a fever as anything greater than 100.4 degrees Fahrenheit. And any respiratory symptoms, the coughing, sneezing, things like that. Those are the key symptoms that you would experience if you have coronavirus. Obviously, the older you are, your symptoms might be a little bit more severe. Again, going back to the more chronic conditions you have, your age, your severity will be greater than someone who is pretty much healthy or don't have any underlying symptoms.
I went to Piedmont Park yesterday, and it was people out there. It was a nice spring day. The sun was shining. I'm of course not sick, and that's how I choose to spend my quarantine break, which I'm very happy to have, somewhat of a break. Today, when I drove past it, it was flooded with people. I was like, this is not social distancing at this point.
At all. I went there this morning, as I was telling you this, I had to go pick up a book, and my friend was at that park, so I picked it up there, and I'm just looking at how many people are in the park riding their bikes, walking their dog.
Picnicking.
It was a cluster of people, and I was like, wow, so much for social distancing. But I will say that I feel like people who are young, especially in our age group, millennials, Generation Z, they, I guess you could say they think they're untouchable, which when you're young, that's, I guess the mindset is that you think you're untouchable. So you go out and you do things because you feel like, hey, I can do it because I want to do it.
I'm feeling fine.
Right.
This is my brain.
Exactly. So I don't think people are really taking it as serious as they should, because I think people are thinking of themselves and not thinking of, okay, well, if I get it, even though I'm healthy, what if I come in contact with someone who is, who is 60 years or older, or who has asthma, who has diabetes, who has some underlying medical condition that already weakens their immune system. I don't think people are thinking about that. They're just thinking of the fact that, well, I'm fine and I'm young, I'm healthy. They said this not going to kill me because I don't have any underlying.
I'm not within the age group. I don't have the issues.
Exactly.
But they're not looking at it from a caring standpoint.
Exactly, because it's not about you getting it. It's really about who you infect,
Right.
So I don't think people are really taking that.
Thank you for even opening up my eyes, because I think I'm probably like one of those people, not really so much looking at it from an individual standpoint. I do know that we are all carriers of some kind of bacteria, disease, whatever the case may be. But I did feel like, well, I'm within this age group. I'm pretty healthy, so I should be pretty good. But my life is already social distancing anyway. So I'm like one of those people. So could you define social distancing for people who may be thinking they may be social distancing but may not really be social distancing, or people who just really don't know what that means? It may just be like another trending topic.
So based off of the CDC, they're saying social distancing is really like 6 feet apart. So think of a basketball player laying down horizontally, and that's your distance right there. So technically we're not practicing it, but I know I don't have corona, and I've been socially distanced all weekend. But that is social distancing, is keeping that 6 feet apart between each other. I think Italy is one country that is doing a great job under national quarantine. A friend of mine is in Italy, and she posts on her newsfeed all the time when she makes her grocery store runs. They only allow a certain number of people inside of the store, just to keep that social distancing. And even everyone who's lined up outside to get into the store, they're not like jam-packed on top of each other. They're within that 6 feet or however meters that they convert it to over there. They're that distance apart. So they're definitely practicing social distancing there. They're doing a really good job with this quarantine in Italy. I feel like they're the standard personally.
Well, I'm happy that a place like that is a standard, because they did have a national shutdown. How do you think that when we actually officially have our national shutdown, it would actually look for us?
I think it will probably look very similar to Italy. I think obviously medical professionals will still have to go to work because we will still have to see sick people. People will still need medications. People will still need management of their chronic illnesses. So I do think the medical professionals will still be at work. I think grocery store clerks will still be at work, but I think it will be within a time window. So in Italy, I believe that their grocery stores are open for a certain number of hours, and I think it's going to be, we're already kind of going towards that.
I feel like it's leading there, but like,
we're not 100% there yet. So like some of the grocery stores are closing at 8. So, you know, I think it's gonna, the
people are slowly starting to scale back. For health professionals like you that don't get like this quarantine break ever because you are, you know, one of the leaders of the world, how are you like practicing social distance within your workplace? And then how are you like responsible for keeping yourself healthy, you know, during this time?
So the organization I work with, whenever we are confirming our patient appointments, there's a questionnaire that our front office staff is calling everyone for when they're confirming their appointments. And I think one of the questions is recent travel, and they ask about respiratory symptoms and fevers and things like that. They basically do a medical screen to see if they meet any criteria that could possibly put them at risk of having corona. And if it does, then they're recommending further testing, and there are testing centers in this area. So that's kind of how they're trying to curtail so that they can be sure that people aren't coming in with coronavirus. Now, we're going to catch everybody? Possibly not, because there are some people who are asymptomatic, meaning they don't have any symptoms, but they can have coronavirus. With that said, it has been recommended to us that we don't necessarily need to wear PPE or protective medical equipment whenever we're going into a room with someone who is presumed as healthy. Now, if you are presumed as having some illness, whether it's coughing or any type of symptoms that that might be concerning, and we don't know 100% certain if you might have corona, what my practice has been doing is putting you in a room that we don't even use, so like far off, to kind of keep you away from our commonly used rooms. And then that's when we're putting on our protective medical equipment. So that's pretty much how we've been, trying to, and every hospital is going to be different. Every every clinic is going to have their own different practices, but that's kind of how we're doing it at my practice, just to kind of keep us safe and keep those who are ill safe. And if you're sick, we're automatically putting a mask on you before you walk in, because helping you keep your illness more contained will
help the spread.
Exactly.
Nice.
Yeah.
That's really nice to know.
Yeah.
And thank you for like the service that you're actually performing within this time.
Thank you.
So let's go back a little bit from like you even being a doctor. Like, what made you even want to become a doctor with this going on?
Well,
because this scares the world.
It does. It really does. It does. And I think whenever you go into the medical profession, you have this sense of faith. I think most doctors go into that. It's just that there's just a sense of faith. We are still human, and we're still susceptible to anything, just like anybody else. But when you go into this profession, the main goal and reason why I went in is to help people. That's literally it. Like it brings me a sense of joy and a sense of fulfillment, and it makes me feel like I am doing my purpose on this earth. So that's one of the reasons why I went into it. And although this is going on and it's unfortunate, I'm still happy that I chose the profession that I chose, because I feel like I'm still able to do what I love. I'm able to help people, and that's what makes me happy. That's what brings me the most joy. So
I like that.
Mm-hmm.
But there's so many benefits of this quarantine break, and I want to know, what are you doing to like on time that you're able to spend? Because I know you're a health professional, you don't get a true quarantine break, but how are you able to spend this quarantine break when you do have time?
So I guess you can say this week would have started my quarantine break. I only work 4 days a week, and I have 3-day weekends. So
that's nice.
So yesterday, I went grocery shopping, tried to get as much that I could, that whatever was left. I'm vegetarian, so I didn't have the issues with the meat stuff.
Yeah.
But
I saw all the vegetables in the grocery store. Every grocery store I went in.
There was still,
I even thought about like maybe I'll just like have
Just
a
be
clean
vegan,
diet
right?
during this time.
Just be vegan.
Yeah.
But yesterday I just started cooking like some of the soups that I usually cook.
Food prepping.
Yeah, that's exactly what I started doing. Just started food prepping because in the event, because I don't know what the national quarantine will look like for the U.S., in the event they shut down the supermarkets and we aren't able to go grocery shopping for a certain number of hours, I wanted to make sure that we had something, food that is available that's already cooked that we can just kind of warm up and go. So that's pretty much what I spent yesterday doing. I made some different soups, some different stews. I made a bunch of different vegetable mixes, and that's kind of what I did yesterday. And today, honestly, I'm probably just going to sit outside on my deck and just chill and drink some wine. Like literally, that's probably all I plan on doing at this point.
Still nice because I'm sure that you need some sort of like a break, from it all, and just to clear your mind and like actually think,
Yep.
So how many days of food did you prep for?
Let me see. I definitely have a week down so far.
7 days.
Yeah, 7 days of food.
Nice.
Yeah, so that's kind of where I'm at right now. I'm not done. I said I was gonna make some red pea soup. I'm Jamaican, so again, red pea soup is a soup that we
nice. Can we get
I
some
know.
red pea soup?
So I'm probably gonna make some. If not today, then probably tomorrow. But that, honestly, I feel like you can't go wrong with food prepping and freezing. My food processor came in handy. Shout out to my mom for putting me on that food processor.
Nice.
So yeah, that's pretty much all I've been doing. And I don't know, on my weekends, I take my time to just relax because seeing patients, being an introvert, it's draining. So when I come home, I just want to relax. And on my weekends, I want to relax. So I won't say the quarantine is taking away from my relaxation. If anything, I'm just, doing a little bit more of the preparations for the unknown. So
that's really good to know. So I'm going to definitely take that and definitely prep because I went to grocery shopping. I did that. Probably bought too much groceries because I went to 5 grocery stores. But I did not actually sit there and cook food. At first, the first 2 grocery stores that I went to, I thought man, I'm gonna be eating a lot of frozen food, and that's something that I do not do. But once I started to find a lot of raw products, because I do eat a lot of fruit and vegetables. Once I found that, which wasn't hard to find, and then I'm still a meat eater. Once I found the meat and certain stuff that I like, it was easier. So now I'm gonna food prep.
Yeah,
for sure.
And we still got gas stoves, so anything you can always still cook, even if electricity becomes a problem,
or even a
Which
grill.
I don't think so. Exactly, a grill.
Even a grill. But I do like how the world is starting to really come together during this time. No one is really honestly making money that's not in those certain fields that the world really needs them. So kind of that whole system has been shut down. So no one is really requiring you to pay certain things. So I like the student loans, how they kind of froze that. I thought that's something that they probably should have.
Please let them go away, Lord, please.
Amen.
Quick prayer.
Amen.
Keep your hands clean. I know people are freaking out about the hand sanitizer, but you honestly need the hand sanitizer when you're out and about. But so long as you're home, 20 seconds, wash your hands. That's what matters. And literally act like you're a surgeon. Get in the crevices of your fingers and your nails. That's how you should wash your hands. And cover your cough. That's the biggest thing. If you do have symptoms, please call your doctor, just so you can get screened and get their professional opinion as to what you should do next, and if you are someone who qualifies to get tested. And if you're sick, keep your sickness to yourself, quarantine yourself. Please let your job know. Again, please let your doctor know. And it was a pleasure being here. Thank you for having me on the show. If you guys have any questions or if you need clarification on anything that I said, please feel free to go to my Journey to One Inspire, my Instagram page, which you should see me tagged to in the video. I'm sure.
You will be.
So you can always slide in my DMs, as Chanel said, and
as the world says,
as the world says, and ask me any question or make a comment on any of my posts, and I'll hit you back and answer your question to the best of my ability.
That's what she's here for. Thank you guys so much, and thank you guys for tuning in to Ladies Room Live. Bye.
So I'm going to show you how to properly wash your hands. Of course, you want to make sure you take off your jewelry, your watch, because I'm sure that's not waterproof. And anything that you wear on a regular basis, like wedding rings or wedding bands, you want to make sure you take those off. You want to clean those too. So I don't know how most people clean their rings. If they just want to use soap and water, you can use that as well. Or if you put it in a solution, that works fine. I'm just going to put mine down for now because I don't really use soap and water for mine. You want to get your soap, lather up your hands, run it through some water. How I start to wash my hands, I just scrub my nails, just like that in the palm of my hand. Overall, we want to spend about 20 seconds washing our hands. I'm probably going to spend a little bit more because, again, I'm a physician. When I was in residency, I also trained with surgeons. So when we had to scrub into surgical cases, we basically had to wash our hands and scrub and do a bunch of stuff like this. And then you also want to get on your thumbs. You want to get all of this. Rub it all in. Get every single finger. This is why it's going to take 20 seconds, because you're actually washing every single finger and you're getting into the webs of your hand as well. So you want to make sure you're lathered all up. Don't get this mistaken. I am not washing my hands like a surgeon. I am just showing the general population how to wash your hands.